author, Dr. Leslie. Dr. Leslie is a well-known specialist in the field of orthodontics with his specialization in orthodontics and dentofacial orthopedics. He is very much in demand for his services. Wow, it's great, huh? And he believes in not just braces, beautiful faces, and has been associated with numerous hospitals for his 15 years of clinical experience. He has also been associated with Cleft International Swiss Organization and has treated numerous patients for nasoalveolar, molding and cleft orthodontics. He is also one of the few certified providers available for Invisalign aligners that are virtually invisible and improve the smile. So please welcome Dr. Reggie Joseph. Actually, Dr. welcome to our South Canara. This is our Philippine Organization project for our health awareness. So I know and we believe that you will share a lot of things tonight.
Yeah, I'm ready to enlighten you all.
So first, this discussion is we'll go through a question and answer portion, and we have some questions from our online who are watching us right now. So I'm just a little nervous.
So, I'm happy to answer whatever I can, and we'll be happy to help whoever is needed.
Okay, so shall we start? So Alvin, shall we start?
If anybody from the audience has any doubts or anything regarding your dental something, you can ask me and we can go ahead, and then when the online thing happens.
Okay. So first question, Doctor, what is the difference of orthodontics and dentist?
Yes, that is a good question, because most of the world, they all think that dentists can do everything. Actually, this is one of the specialty in dentistry, a super specialty, which only a certified specialist can perform. Somebody who has underwent dental training, dental school, and he has to go for master's education for 3 years or more. Depending on that, only they can go for this specialty. And always I would request all folks, please make sure you visit an orthodontist to get your treatment done. Every dentist is not an orthodontist, but every orthodontist is a dentist. That is the difference. So this is one thing I advise all people around the world, whoever is seeing us should know. Because they consider dentist and orthodontist as the same. No, it's not. A person who is a dentist cannot be an orthodontist. But an orthodontist is always a dentist. Because it's a specialty. That's the reason.
Okay, Doctor, another question is how often you need to visit the orthodontics?
See, out in European countries now, what they say is basically they start visiting the dentist first at the period of 8 years, when a child is 8 years old. That is when, if the child doesn't have any trouble, that is when he should be first visiting the dentist or orthodontist. For according to the orthodontic, the American Board of Orthodontics, every child around 8 years of age should be the time he should be consulting an orthodontist for the first in his life. That is because a child at 8 years of age is in his growing stages. In this growing stage, we can do certain treatments which are related to the jaws. You know, there will be some people who have a long jaw, some people who have their jaws which are short. So these kind of problems can be assessed early in life. It can be corrected early without surgery. What happens if you miss out on the early years before till a person attains puberty? After that, the range of treatment changes. what can be simple orthodontic treatment can be complex. This is the other part which happens to people. So 8 years is the first time anyone should be going to an orthodontist.
So usually, Doctor, many of us, we have some questions at the back and because normally going to a dentist for braces is you mentioned a lot of things about it. So can you share about it to us?
Yes, basically I always tell patients when they come to me, I ask them, the first question is, why do you want braces on your teeth? These are ugly looking things. I mean, nobody wants, your teeth is the best thing that you have. Who wants braces? So, who likes to have a metal spine? It's something different, odd. Yeah. So, but then again, there are a few people who want to be different from society. But again, I always ask my patients, what is the need or what was the reason they went in for braces? Because only if you know the reason, you can treat them. Now, there are certain people who want it just for fashion. That's fine. It's okay to treat those kind of people. But then there are some serious people who have serious difficulties in life. Maybe chewing food. Maybe he's not looking good or she's not looking pretty. And the world is not accepting her and she is not confident of her life. Now for these kind of people is where orthodontists can be a big help.
Okay. We have a question on our online and they're asking about the scope of our orthodontics. Can you share with us, Doctor?
As in the scope, you mean for a job perspective or as in what an orthodontist does?
Is it okay, Doctor, if you can share us both?
Okay, scope in the sense, okay, let me make this a little short. Scope is like basically we treat treat the teeth for the smile. Okay, so orthodontics, the main scope is we do anything with smile correction, teeth alignment, the jaw correction, the bite corrections. Now these are the only things which orthodontists can only do. So that is the basically about the scope. I think there's another question also coming in.
Okay, they are asking why do we need to take care of our teeth? And is there are some diseases involved if we do not take care of it? And how will it be these dental problems made as fatal or something else?
Yeah, see, let me tell you this very, very short and nicely. We need to take care of our teeth because I'm sure nobody likes people without teeth. How many of us don't have our teeth and are not happy? Anyone can give me a smile without the teeth?
I think we can ask our audience right now.
I don't think anyone here would have that. So see, the minute we smile, the best thing among humans is having your teeth there. If you don't have your teeth, if it's not there, you're going to look different. You're going to look out of the world. So the first and foremost thing is to keep them there, we need to take care of it. It's like servicing the car, as I always tell my patients. You take care of it, it gives you service for your life. You abuse it, it doesn't serve you. It just falls off or you have to get rid of it. So this is the reason. Now the other reason medically what can be the importance is that, for if you have your teeth, you can chew your food properly. You don't have digestion problems. Now people don't realize they don't have their molar tooth, the back teeth, and they will eat food and they think that they're eating food, they must be having some digestion problems. Unfortunately, this poor chap or person doesn't know that because he's not chewing his food properly, he cannot digest his food properly. And he's having different problems like acidity, maybe some bloating of the stomach or whatever other problems that a sign comes to. So caring for your teeth is medically also very important. I'm sure God wouldn't have given us teeth if it was not important for us.
For follow-up question, doctor, which one is better, if root canal or the implant?
Well, for me, I will always tell, try to keep what is ours with us. Yeah? Because implant is always a foreign body. Okay? It's not a replacement for our own teeth. But when there is no other option, yes, implant is the only option available. Now, if there is an option, right in the Philippines, I think most people, they prefer to remove teeth. I don't know why, but a large number of Filipino patients that I see here in Qatar, the first thing that they tell me is, doctor, it's very painful, the root canal, just get rid of my teeth. And I tell them, see, madam, sir, this is the thing, you have your teeth for life, you just have to spend some little money for that to save that teeth. And you know, you can have it for the rest of your life, maybe for how long ever you live. This can be for 90 to 100% of the people. 10% of the people, what happens is, after a root canal, there can be failures. Now, end of the day, dentists are not God. So, some people survive without any issues, without any pain, but some people have a bad experience from a root canal done from somebody in the family. And then they tell that, no, this is not success, this was not right. I agree, 10% failure you should give and take in everything in life. So even root canal should be considered like that for everybody. Have our own teeth, it's the best. Implant comes next.
So, I have some friends, doctor, that they have, especially when I was young, and they are telling us that there are two kinds of teeth, this yellowish and white teeth, and yeah. Why is it happening, or what is the difference of these two?
Yeah, let me explain that. Okay. With two types of teeth. Now, for all human beings, we have two sets of teeth. One set of teeth comes in when we are very young in life, starting from 2 years till up to the age of 12 years. That is our first set of teeth. The second set of teeth, and that first set is called milk teeth, commonly known as milk teeth or primary teeth. Okay, this is the first set of teeth that every human being has in the world. The next set of teeth are called the permanent set, and the permanent set of teeth starts completely being there from 12 years upwards till 100 for a person who's living till 100. So there is no particular age other than that. Unless he is not taken care, he will lose it. So the second set is the permanent. It comes from 12 years onward. It starts from 6 to upwards. Right from 6 years, we start getting our permanent teeth. So that is why every person in the world should be careful from 6 years onwards.
So if anyone or someone has a diabetic, how do we need to take care of our teeth?
Yes. Again, diabetes. Now, some people wouldn't be understanding how they are having bleeding gums, how they are having loose tooth. Okay, so and they wouldn't be knowing that they have diabetes. So if they have these conditions, they should go to the medical doctor, get a checkup done, and find out whether they have diabetes, because diabetes is directly related to the disease.
And it's difficult if it should be less blood.
Yes, there should be less bleeding, less trauma. As we all know, for a diabetic person, it's very difficult for wound healing. So it's very important that we have to keep our teeth safe, because if we are not kept it safe, we have to extract it. Extraction and diabetes, it's like creating a wound. Removing a tooth is like creating a wound in our body, and which takes time to heal. So I think we should all be very careful about it.
Now we have another question here. What are the causes of polyposis, or for others, I would call it bad breath?
Yeah, commonly known as bad breath. Yes, exactly. A good question. This problem is seen mostly in the Middle East is very high because of the climate that we are in, one reason. Mostly because we don't consume enough water. Okay, we all live in air conditioning, we don't sweat, so we feel that our body doesn't need water. But fortunately our body needs a lot of water. The minimum amount of water that we have to take is at least 2 liters per day. And I'm sure if you look back, most of you wouldn't be drinking those 2 liters of water. You stay hungry, you're going to have bad breath because the gastric juices which releases in your stomach will come out through your mouth. This is one of the reasons. Not having water in your body makes dryness. Dryness again leads to bad breath. Third thing, you don't clean your teeth properly, you can have bad breath. You have cavities or infections or bacteria in your teeth, this can cause bad breath. So all these reasons put together are the causes for bad breath. It's not just one alone.
Okay, even doctor, if you, for example, you brush your teeth at night and then when you wake up in the morning, it's still the same.
Yes, that is because you don't have saliva running in your mouth throughout the night. When you're sleeping, your mouth is, if you notice, you will have dry, not very, wet mouth. You will have mostly a dry mouth because we will be having some amount of dryness in the mouth, and this is one of the reasons we have bad breath at night.
So you need to say, doctor, we need to drink water at least before we sleep at night.
Yes.
That would, how many glasses we can do it?
I mean, when you say glasses, it is not like just because you drink water that next day morning I won't get bad breath. No. It's just that for some people it's more, for some people it's less. But drinking water can help a little.
So, another question about how to prevent dental what is the best home remedies for it?
That's a very funny question.
Yeah.
Because it all depends on the food we eat. Like I told you, it's because we abuse our body, we have problems with the diet, the food that we eat. Trying to prevent intake less sugar, brush twice a day or thrice a day or after every meal, take good care, you will not have cavities. That's for sure.
I have in my office, we talk some random talks only, and one of my colleagues told me it's not good to use the toothpaste that we are using. So they said that it will wrap our teeth and it will it's not good to our teeth. How correct is doctor?
I wouldn't agree to that. You cannot say toothpaste is not good to our teeth. Toothpaste keeps our teeth fresh, or it removes the germs from our teeth. Now, we eat all sorts of food in the world available. When we eat all these things, there is some amount of it will be stuck onto the tooth, which cannot be seen with the eyes. Now, suppose we eat from let me tell you an example for this. You eat from a plate, okay? So, you fortunately have cleaned up the plate nicely. You must have you wouldn't feel anything is there on the plate. Will you eat that meal again from the same plate without washing the plate? Would we use soap to wash the plate, or just put water and put back the meal there?
The soap.
Why?
First, we want to make it have a smell.
You want to feel it's clean.
Yes.
Yes, because if you touch it with your hands, you're going to feel some slimy thing on the plate, or it's not smooth and rough, clean as usual. The same applies to our teeth. You try that. I mean, any of you don't brush for a day, eat the next day, see how yuck you will feel. So the only thing we can use is toothpaste.
Okay. So,
We have to use a toothpaste. Again, there are sometimes companies bring stuff which they say this will make white teeth, this will make more shiny teeth. I don't believe in those kind of things because those things don't happen. They are just very, very not visible to the eye. The companies make promotions and that's,
Or teeth whitening.
yes, they brand it like that. But it is not true to some extent. Maybe microscopically they might see some difference, but I'm sure none of you all will appreciate that kind of whiteness. So that is why with those kind of materials, don't use abrasives. Toothpaste, regular toothpaste should be used. Not toothpaste with too much charcoal, too much substances which can harm the teeth. And like I said, any habit or anything that we do in excess can cause harm. In the right amounts, it's always the right thing.
In the Philippines, most especially those living in provinces, they use the salt as toothpaste.
Yes.
Is this helpful to
See,
our teeth?
salt is a wonderful substance which is given by nature for our body. It can heal also many wounds. It can help with the gums, it can help with healing, it can help with cleaning the teeth also, yes. But like I said, for a person with diabetes, salt is not indicated. And he's going to use salt and keep brushing. It's dangerous. I'm sure half the population in the world have blood pressure today. So salt is not indicated for such people, and I don't think those people should be using salt to brush their teeth. Also, salt is more abrasive, like charcoal, salt. Then there are some things, even in India, in the earlier days, they used to use these stuff. But later on, we saw the harmful effects that it had on the teeth. So that is why we came over now, and most of them, we advise to use a toothpaste or something, make it a paste form. Don't abuse whatever you're using to clean your teeth. You can use whatever you want, but prove the right amount, the right pressure, the right way.
Okay, how would we be able to take care of our dentures?
Dentures.
Dentures.
Removable.
Yeah, the removable dentures. Now, removable dentures are always a thing of the past. This is because today we are trying to replace removable dentures. We don't want people to be embarrassed, don't want people to have removable dentures anymore. We are trying to tell them, let's get fixed things, because even these removable dentures can cause bad health. So that's why we always tell people, try to get permanent fixed teeth so that you won't have different problems with dentures. Now, dentures, when they are removable, there are chances that it can fall off at any point of time when you are speaking to someone. It can get broken in the middle of the day. You might swallow it at night by mistake. So basically, try not to get too much of removable dentures anymore. We have come through dentistry, and I think today we should be trying to see what is more in the medical field. Try to use the advances that science has given us, like implants, like I said.
The doctor, actually, the question is how much? How much usually are the fixed dentures, depending on the...
You mean the cost?
Yeah, the cost usually.
Well, the cost, it again varies. When the newer material comes, the older material can be cheaper. Now, I'm sure in Qatar here, the fixed dentures, the fixed teeth, the steel ones, cost much cheaper. I think around 500. That is the steel one. Okay? But if you go for tooth material, tooth color, it ranges from 900 upward, depending on clinic, depending on person to person, whichever clinic you're going to. It's like that. Like definitely, when you want Adidas or Nike, it's a different price, and when you want some local company, it's a different price. So it all depends on that. Now again, some doctors feel that their work is good, so they might price it higher. They feel that their complaints are less from the patient. they price it higher. The lab, again the lab, there is a lab involved in this, the work involved in that. There are so many factors and these factors affect the prices. So it all depends on individual to individual or clinic to clinic. I cannot tell exactly on the price, but I would say it's always better to see what is best for you, to validate. I mean, you know yourself, so you should be understanding what is the right amount and what is it that you believe is the right thing.
Another thing, Doctor, especially to those our viewers right now, to those people also with having braces, how many times we need to replace do we need to replace it for the second time or for the braces?
Reinstall.
How many times reinstall it?
Well, there is a big confusion here. Now, we reinstall braces only because the first braces fixed were not working in the right way. This again depends on the material of braces used in the market. Now, when I say materials used, it again depends. Like, the doctor should be knowing what he's treating, how he's treating. Internationally accepted materials and companies are good. Then there are some products which are, they look like braces, they act like braces, and they don't work like braces. So these braces, and then finally the wrong person in the wrong place, and then this person goes to the right person in the right place. That's when the reinstallation of braces happen, because what happens is you must not have fixed it properly, or the first braces wouldn't have been fixed in the right manner, or the quality of the braces is not good. So when the quality is not good, when you go to another place, the material changes, the wires change, the elastics change, and the older braces cannot handle the pressure from these wires. They collapse. And if they are starting to collapse, that means there is fatigue in the metal that is there. The teeth won't move, because the minute it starts collapsing, it starts binding with the wires. So once it starts binding with the wires, we have to reinstall, because there is no other way, because the teeth won't move. And our whole purpose of putting on braces is moving the teeth.
So this is not it depends only on the alignment of the teeth if we need to reinstall it.
Yes, exactly.
But the gums also, if for example the gums are quite loose and you have a braces, but it's also there's a problem with the gums, it's quite loose, what will happen?
Yes, there is a big problem there. See, the gums are loose. The first thing, we shouldn't be thinking about braces. Okay? Those people should first be looking at trying to have their teeth in their mouth. When you have a gum problem, your teeth is going to be loose, you will lose your tooth. When you put on braces, your teeth is going to be loose more. You understood? So basically they should be taking care of the gums first, then going for the braces. This is the reason. So if they just feel that they want to just reinstall the braces and their gums will be proper, no, it is not. See, braces is something extra on your teeth. So there can be more deposits on your teeth. Your gums are going to be less healthy. The reason your gum is less healthy in the first place, or the teeth are moving in the first place and gum problems, is because you haven't taken care of it in the beginning. Sorry. No COVID. So basically it's gum problems which we have to take care of.
How do we take care of the gums then? Usually it's advertised.
Sorry.
There's no toothpaste or...
No, there are toothpaste. Basically, I would tell everyone, visit your dentist every 6 months. Get your teeth cleaned 6 months once. If you are a smoker, if you have some habits, get your teeth cleaned 6 months. Or else for normal people, once in a year. People who don't smoke, people who don't eat all those abusive stuff, they can wait for 1 year. But the remaining happy people who do all sorts of things, every 6 months they should be visiting a dentist, getting your teeth cleaned. That is the only way you can protect your gums.
Okay, Dr. Before you continue, For our viewers, we would like also to, if you have some questions, may mga tanong tayo kay Dr. Pwede po natin i-prepare yung ating mga tanong sa kanya. And let's feel free any questions na pwede natin itanong.
Tanong ka. Tayo ka.
Doc, I just want to ask if how can I take care because I have my root canal. How can really I take care because sometimes I am doubting when I'm brushing my teeth, it have blood.
See, what happens is the root canal, if it is completely done, properly treated root canal, should be put, you should be having a crown on the teeth. That is when a root canal treatment is said to be complete. Finishing a root canal is not completion of the root canal treatment. Most people, they go to the doctor when the pain is coming. So when pain comes in, the doctor advises, okay, let's do the root canal. And they do the root canal treatment. And many a times, because of the cost factor involved, the doctor is reluctant to tell the patient, you should be having a crown on the teeth or a cap on the teeth.
Yeah, I have that.
Yeah. Once you have the cap, what happens is that if the cap is not fitted correctly, this is the problem with the cap, not with the root canal. The cap is not fitted correctly, you will have food going in between. So this food should not be there. It should either be eliminated with brushing, flossing, or you should have the dentist to replace the crown there. It should usually not be sitting there. Food should not be accumulating there. That is very, very important. This is why I said everything depends on the price and work. Everything is like, it has to be perfect for you to not have any issues. If you are somebody who takes care of their teeth very well and having this problem, it can be three things. Either it is not a good workmanship because there is a lab involved. The cap wouldn't have been a perfect fit. Now, that can be one of the reasons. The other reason, your gums have gone down. So there, nobody can do anything. This is going to be a genuine problem and you will have to just keep flossing or keep using interdental toothpicks and interdental brushes to keep that area clean. And definitely go once in 6 months to the doctor to get it clean. So that helps in stopping the bleeding.
Okay, but only that bleeding when I sometimes maybe because of the brush or we need to choose a good brush.
Yes, that is because you are consciously trying to force yourself into that area. You're hurting your
like
gums. That is because you're hurting your gums. So that is like excessive cleaning.
Yeah, because I am thinking, doc, it's
No,
like
that is
normal,
because
because-
you feel that there is food inside and you are trying to clean that area more.
Yeah, but I didn't like touching the crown. I didn't even
No.
touch. Only
Yeah.
the side.
Yeah, you're doing it the side, but you're
Yeah.
hurting your gums.
Because I was having root canal last 2020, but it's good because I didn't
Feel
feel
any
any
pain.
pain
Yeah.
until now. It's like 2 years. So
Yeah.
only that my concern.
Gums. Yeah, because that is because food was going in there, so your gums went a little down. So because of that, you have the small gap there, and maybe food is going in between, and they have to get it clean. Just keep it clean. That's it. Don't hurt your gums.
Okay, now for final question, how often we need to replace our toothbrush? And also, the next question is, what is your stance in regards to this automatic toothbrush? As we all see that there are automatic toothbrushes in the market.
Yeah, the automatic toothbrushes are not bad. They are good. I'm not saying, I don't say automatic toothbrushes are good or bad. Everything can be used according to the way you want your comfort. Brushing properly, the technique for brushing is what is important, not the brush. The automatic toothbrushes, they help you, like you don't have to apply pressure. You just have to hold it in one direction. So that will help, definitely. The regular brushes also do the same thing, just that mechanically you have to use. your hands. So if you're a lazy person and don't want to use your hands, go for orthodontics.
So how often do you need to replace the toothbrush?
Yes, a good, very, very good question. I think most people don't know that. As soon as your bristles or the brush goes wide, like the bristles become wide, please make sure you change your toothbrush. This again depends on the pressure that you use. That is the reason. Because the minute you use pressure, these bristles will get wide. I am sure if you see your floor brushes, it must all be wide and you will be still be using it. So, yes, thank you so much. You will be still be using it. So, when your bristles are wide, we are not on the floor. So, it's the tooth, it's our body. So, replace them. There are very cheap things available because if you don't replace your toothbrush, you can hurt your teeth also. Just excuse me for a minute.
Okay, any more questions from our audience?
Question. It is, I will try to translate it. Doc. Okay. I'm working as a household worker kadama, and my my employer doesn't. I asked my employer to bring me to the dentist because I cracked my teeth already, and actually the crown is already gone, but I think there's some remaining too there. But my employer doesn't want me to bring to the dentist. So what usually can I do so that to ease the pain?
So, the first thing, you can ease the pain by having some painkillers from over-the-counter painkillers. Now, if this person is really in pain, I think she should be at least going to the pharmacy and getting in some over-the-counter painkillers. Okay, so over-the-counter painkillers can relieve the pain for some extent. But if it's still not stopping, I think you should tell your person in charge that you have to really go. You cannot hold on any longer because even he would not be having such kind of tooth pain. He would not be staying home if he has tooth pain. So I think that is something they should really look into, and she should try to get hold of, or go and walk into the nearest PHCC if she can walk in and get some medicines.
What did that is everybody's
That-
right now.
That is everybody's right to get treatment. See, anybody in pain cannot work properly. So I believe that you should relieve your pain first and then only think about working next.
Actually, that's the usual problem with the household
See, the main
workers.
reason might be because the owner, the kafil fees that it's expensive.
Mhm.
See, it's not expensive. There are clinics which don't even take money sometimes from patients.
Mhm.
So you can just go there and get your see the doctor and get some medicines. So you can tell that or you can tell the household somebody to help you around. There should be somebody at least going out of the house. At least the driver who's going out of the house can go to the nearby clinic and just tell the reason and maybe also help.
Panadol is okay.
Panadol is okay, but there is going to be only a small effect. That person maybe can have something like Brufen, or maybe
Brufen.
Cataflam. Yeah, these
Brufen
are
or Cataflam. Those are over the counter.
over-the-counter medicines.
Okay, to our audiences, do you have any more questions?
Doctor, what is the cause of gingivitis and how to treat it?
Yeah, that's a very interesting one. Gingivitis. We spoke all about this from the beginning. Like I said, maintenance. We are not. If you don't clean your tooth, we have deposits on the teeth. Now, when you have deposits on the teeth, it will not happen in a day. It happens over a period of time. The reason being, there is a small space between the teeth and the gums. If you see clearly, there is it's like our nails and skin. Now, when your nail grows, there is a small space between the nail and the skin. I'm sure all of you all can see that. So, if you see that, the same way on the teeth, there is a small space between the teeth and the gums. So food gets entrapped in that space. Over a long period of time, the food sitting there, and if you're brushing not in the right manner, food is going to be there. It's going to cause you inflammation. The gums are getting irritated, and that's how gingivitis starts. Gingivitis is nothing but inflammation of the gums or reddishness of the gums. And then slowly you don't respond or you don't look into it, then your body says, okay, he's not taking care of me or she's not taking care, let me start bleeding. So then the next thing happens is bleeding. You don't take care of the bleeding, okay, now then pain. The body says, okay, let me give her pain. So pain starts. No, you don't take care, okay, I'll start moving your teeth. And then you don't take care, okay, remove me. That's what it goes.
Thank you, Doctor. Any more questions from the audience? Let's take this opportunity that our resident doctor is here with us.
No. Why this other dentist they will recommend
Pasta?
root canal? Why?
When
And they
you,
made it remove, you know?
and they remove your teeth.
Useless. I pay 500.
So let me tell you that again. There is an issue there. That doctor must have started with a good intention. Unfortunately, it didn't go the right way. The tooth must have had, root canal is again different thing that we should take care of. Is like, it requires a specialist again, sometimes. Some root canals has to be done by the specialists themselves. There are root canal specialists, like how I told you, braces has a specialist, even root canals have specialists. All dentists can do root canals, but all root canal specialists are not, all dentists are not root canal specialists. Again, the same thing. So what happens is when we do the root canal, sometimes if the person is not a specialist or if the decay is more into the root, like if it cannot be saved, then it's a problem. We might initiate the root canal, but what happens is if the caries is deep inside the root, like it's below the bone, then we cannot save that teeth anymore. That is the reason they must have planned for extraction. So that is why I say diagnosis is very, very important. It can be operator mistake at times. I'm not saying everyone is perfect and there is no mistakes. Yeah. So it all depends on person to person and what was the condition of your teeth. It again depends on that also. So it can be two things, like I said. Either it can be because of the teeth or it can be because of the operator. Now which one it was, we cannot say now since they have removed the teeth.
So another question from Crazy.
I have a child, then his teeth all
BBT,
baby teeth all gone.
all removed.
Yeah, all removed. Then when? What age should?
How old is the baby?
6.
6 meaning he's supposed to get his first tooth now. The first permanent teeth will be coming at 6. In 6 years, his first permanent molar teeth will come the back side.
Yeah, because it's like he is 3 years old at the time, all the day gone.
Yeah.
Then I was amazed. Why until how many years na?
No, it will not go like that. It must have gotten decayed because of the food that was there.
Yeah, because it's
Because of the food habits, that's what I said. Maintenance is very, very important. Every family, every person in the family should take care of the child's teeth. I know children are very difficult to manage. They don't like brushing. They will throw tantrums and you all will not do the brushing. They will be crying, they will say, but if you want your children to eat food properly, try to give them less sweets, less carbohydrate, and brush their teeth regularly. That is the only solution we have for this. Otherwise, you have to wait until 6 years for the next set of teeth. But mind you, even at 6 years, if your habit is not changed for the last 3 years, the next set of tooth will get going in very short time.
Okay. Doc, I have one question. Okay. Actually, this happens, I think, 3 or 4 years ago. There's this one Filipina who's working in West Bay. Actually, we know her. What happened is that she experienced a swelling of the gums, and I think she has undergone a root canal. After 5 days, she died. So what do you think happened?
No, again it depends. We have to know whether she had a systemic condition.
Okay.
See, if she had a heart problem.
So possible that it is caused by the heart
Heart
problem,
problem, yes.
not because of the teeth.
The problem is it's bacteria.
Okay.
Teeth has bacteria.
So
So that bacteria goes into the heart
arteries.
arteries, then we cannot help it. This is called bacterial endocarditis.
Okay. So that is possible.
That is possible.
So if you're not taking care of your teeth and it swells and bacteria came in, then infection will happen. It will go
The
to the
infection
heart.
will spread fast. Now that is unfortunate for that person, but usually this doesn't happen. Unfortunately, it can be one of the reasons. That's it. Not always. So it's not like root canal is dangerous, but like I said, this is because it was not taken care of in the right manner. That is what we all treat teeth like it's very small and very unimportant.
Yeah.
Only when such things happen, we realize, oh my God, this can happen. That's why I always tell people, even if it's just teeth, don't think that it is very small. It can cost your life.
Any more questions from the audience?
I think one of the question, Doc, is that why is it important to have a right aligned bite?
Like I repeated earlier, chewing food properly is one of the reasons. The next thing is better. You won't like to have crooked face, right? So if your teeth are not aligned properly, you will have some crookedness or something not symmetrical on the face. You can have joint problems.
Okay.
You can have headaches. You can have clicking sounds from the joint.
I think that is painful.
Yeah, which can be painful, not initially, but maybe as you get older. So that is the reason it's better to have well-aligned teeth. It's always best.
What if, Doc, the misalignment is from the jaw? Usually
That
there
is
will
why-
be some operations.
That is why, yes. That's why I told children, people should be seen at early, so that it can be surgeries can be avoided as much as possible. And if not avoided at that point of time, then later on we should plan for surgeries.
Surgery. Orthodontists can do that.
No, not orthodontists. Only maxillofacial surgeons. There are
Okay.
again maxillofacial surgeons. Dentistry has 9 specialities today,
Okay.
and it's growing. Maybe I don't know tomorrow what can happen with the science
Okay.
growing. So up till date we have 9. So
Okay.
and each one has a specialist. Like I said, root canal has a specialist. Crown has a specialist. Every dentist can do all these things, except for orthodontics. That is one thing which is not taught in dental school usually.
Okay, thank you so much for answering those questions. So, still we have questions.
Last question.
Yeah.
Do I expect for example, in the future, I will make remove this, yeah,
Mm.
canal?
See, once root canal is done, it is for life. You don't have to remove it again.
Maybe
If it is not having any problems, you don't have to remove it. If the crown is broken, you need to replace the crown, not the root canal. Unless you have pain on your teeth or some issue with that teeth, your root canal is fine. You don't have to. Because I have root canals which are maybe 10-year-old in my teeth myself. So it's not a problem. The properly done one should not give you.
Okay. Asa kung wala na po tayong mga tanong,
Minutes and last. May tanong po ba tayo? Kahit Tagalog, translate
can speak in Filipino language and we will help you to ask
Regarding
those questions of our doctor.
I think they're going to ask about cigarettes, doc, in the teeth.
Cigarettes, yeah.
What can you
That's
say
a
about
very
cigarettes?
common question.
That's a very common question because I wouldn't say, see, I advise all people, do what you want to do, but again, do service also at the same time. If you are managing to buy a packet of cigarette a day, that means 20 to 25 real. So if you can save 10 real additional, so save 10 real additional, you can clean your teeth every month. But 30 days, save 10 more. So if you're spending 25, make it 35. Keep 10 real aside. Go for a cleaning every month or every 6 months at least.
Okay, Doctor, can you share us? So since we don't have any more questions from our online and also our audience, can you give us the package for the dental here in the
Packages, we are right now introducing one for the braces and for Invisalign. Okay, that is again the braces, the invisible one. So those are just
Transparent?
the transparent ones.
Oh.
So those are just coming in. I think we start them at around 5,000 for the down payment. That is for the Invisalign, and for the other one will be around 450 maybe for the Invisalign, for the braces, normal braces package. So we will be starting at 450. That is the initial payment, and then there will be monthly payments as and when they go.
Okay, thank you so much, Doctor. And lastly, can you give us a message or anything to take for all of us here?
I would tell everyone, take care of your teeth. They are very, very important. Go to the dentist, not when you have a problem, but before you have. Whenever you have time, whenever you feel the slightest of the problem, please try to visit them. Till then, don't wait for you to have, or your body to respond to pain for you to go to the dentist. I know even myself, only when there is pain or when we are troubled most of the time, we go to the dentist or the doctor. But if you catch your dentist early, you save money early. You save more money. It's like depending on the size of the cavity on teeth. It's very much in correlation with the depth of your purse. As the cavity is getting bigger, the purse depth also gets bigger.
Okay. Actually, Doctor, there's one question from one of the leaders of the community there. He's asking how long will the braces usually treatment takes, and I think he asked again what are the benefits of the braces. Yes.
See, braces treatment, minimum time according to me is 1 year and maximum maybe 6.
6 years.
Yeah,
6
because-
years?
Yeah, 6 years.
Oh.
It's all because of the patient sometimes not going to the dentist on time or the dentist not being there on time. So it all depends. But actually it
So
should
the
be,
adjustment, Doctor, is usually monthly.
yes, it's usually monthly. It can go up till 60 days. That is not a big problem. In case of some emergencies, it can go up till 60 days.
But beyond 60 days.
Beyond 60 days is not a good idea because your problems like bleeding gums, issues, the tooth movement, how much has moved in, we don't know. Whether it is a complicated movement which has happened or an uncomplicated movement.
And some deposits on the side.
Yeah, and we cannot, it's not like watching a movie, we cannot put a pause button and tell, okay, now don't move. So we see you in 30 days, we know, okay, this is not working in the right way, we change things.
Okay.
But we see you after 60 days and there is something which is not right that has happened, and to undo what is not right will take more time. So that is why the treatment goes longer. So it all depends on the doctor and the patient. Both cooperate together, both do the things properly, they will finish it. Usually the treatment should finish anywhere between 1 to 3 years, maximum. Maximum. Not more.
Doctor, what days do you visit you here in
Here at NOVA, procedures can only be taken up till 8:30 because after 8:30 doing a procedure is a little difficult. That's why, because we have to sterilize and